are about over 2 million people across the globe who have currently been treated for the coronavirus, and among these there are 100,000 people who have lost the battle. But despite the doom, there is a ray of hope, with over 400,000 people who have recovered across the globe, including about 50 here in the country. And since December 2019, when the first case was officially reported in China, millions of patients have and are currently going through treatment in various hospitals across the globe, including here in Kenya as well. I spoke to one patient who just returned home from hospital after winning the battle against COVID-19, albeit in a faraway land.
Okay.
Stephen Kinuthia will be spending the next 7 days in this space in his home, the final step in the monitoring imposed by French health officials before recovered COVID-19 patients can resume their normal lives. He was last here 2 weeks ago, just before testing positive for COVID-19 disease.
I've transformed my office downstairs to a bedroom, to my own bedroom, but there will be a follow-up for them to see how I improve, and at the same time to see that they will follow up my family to see whether there is any viral or contagious issues.
Different sides of the chest are the lungs.
That test, a result of him exhibiting the worrying COVID-19 symptoms.
When I went to do the scanner, immediately the radiograph, or the people who are doing the scanner, they saw that I'm in a very bad state. And the French system is that once you are in any medical, be it private or public, they call the ambulance, and the ambulance brought me here.
From hospital.
France is among a number of European countries that have been severely hit by COVID-19 and has ensured that all its major hospitals have specific units to cater for COVID-19 patients. Kinuthia says that he was first admitted to the ICU unit at the St. Louis Hospital in Paris between the 2nd and the 10th of April as doctors raced against time to ensure he was out of danger. Stephen says his experience in Europe is probably different from how things back home are working. With just about 200 patients, Kenya is now just feeling the upwards trajectory that is the COVID-19 curve. And while only a few patients are in the ICU, Kenya says that majority of her patients are suffering mild symptoms.
So in France, they are not using chloroquine. They have their 3 antibiotics, which they are doing a research. And there's a research which is, giving very positive results.
In France, Kinuthia says only severe cases are being admitted into hospitals as they lack bed capacity to host the many patients they are still receiving. At the moment, priority is given to the seriously ill. While his journey to full recovery will be long, Stephen says that he is grateful to God for a second chance and the great healthcare system that cared for him while in hospital. As he was discharged into the arms of his wife, he is now looking up to them to continue giving him care at home.